So what is ejection fraction? A lot of people are asking me, what is ejection fraction? It's how hard your heart squeezes. It's basically how strong is your heart. Your heart's supposed to squeeze like this with every beat, but sometimes it's weak. It's just barely pumping. It's not pumping strong enough. Normally your ejection fraction is like 60% or higher is considered normal. But even in some places as low as 50 to 55% is considered normal. Once it's below 50, we say you have systolic heart failure or systolic dysfunction, whatever you want to call it, cardiomyopathy, which means your heart is pumping weak. The number one cause of that is usually coronary artery disease. That's why we usually recommend a cardiac cath. The way we check for this is either with an ultrasound, or sometimes we find it on a stress test, and sometimes we can use something called a mugascan, which is sort of like a nuclear stress test minus the actual stress part. We just put you under the camera, inject the tracer, and see how hard or how well your heart is squeezing. There are lots of treatment options depending on kind of what the cause is. If your cath is clean, then it's not ischemic. We put you on medications and get it stronger.